Today, we're exploring the often grim and gritty reality of hygiene in the Wild West. Prepare yourself for some eye-opening and possibly stomach-turning facts about daily life on the frontier. Number 1. Bathing practices. Bathing in the Wild West was an infrequent and communal activity. Access to clean water was limited, and soap was expensive, often leading people to bathe only once a month or less. Bathhouses, where available, offered shared facilities with minimal privacy. These establishments were commonly found in larger towns and catered to travelers and residents willing to pay for a soak. River and lake baths were more common, but came with the risk of contamination from both animal waste and human activities. People sometimes relied on makeshift bathing solutions, such as using a basin of water to wash quickly. In rural areas, pioneers would bathe in streams or ponds, but these natural sources were not always clean. The scarcity of water meant that even basic hygiene was a challenge. Additionally, the harsh environmental conditions often made finding a suitable bathing spot difficult. Settlers had to contend with dust, dirt, and grime, which compounded the issue of maintaining cleanliness. The use of soap was a luxury, as it was both hard to come by and costly. Homemade soap, when available, was often harsh on the skin due to its rudimentary ingredients, typically a mix of animal fat and lye. This made the bathing experience far from pleasant, leading many to forego it unless absolutely necessary. Number 2. Dental hygiene. Dental hygiene in the Wild West was rudimentary and fraught with pain. Toothbrushes, when available, were often crafted from animal bristles and shared among numerous people, leading to widespread oral infections and disease transmission. Proper dental care was rare, and many people turned to barbers and blacksmiths for dental procedures. These individuals had minimal training, and their tools were basic and unsanitary, frequently causing more harm than relief. For toothaches, people commonly used whiskey as a numbing agent. They would swish it around the affected area to dull the pain before a tooth extraction. This procedure was brutal and performed without anesthesia, leading to severe discomfort and often infection. Tooth extraction tools were crude, resembling pliers more than the precise instruments used today. Cavities and other dental issues were generally left untreated, causing many to lose teeth at an early age. The lack of proper nutrition also contributed to poor dental health. Diets high in coarse grains and low in fresh produce led to widespread dental decay and gum disease. The Wild West's environment added to the dental woes. Dust and dirt were omnipresent, contributing to poor oral hygiene. People rarely brushed their teeth, and when they did, the methods were ineffective. Baking soda and salt were sometimes used as makeshift toothpaste, but these were abrasive and could damage tooth enamel. Communal drinking cups and poor sanitary practices in public places further exacerbated oral health problems. Gum disease was rampant, and many suffered from painful abscesses that could become life-threatening if untreated. Number 3. Personal cleanliness. Personal cleanliness in the Wild West was a significant challenge due to limited resources and harsh living conditions. Clothing, often made from heavy, durable fabrics, was infrequently washed. This led to a buildup of sweat, dirt, and grime, contributing to strong body odors and general uncleanliness. Washing clothes was labor-intensive, requiring manual scrubbing in cold water, often without soap. Men commonly grew beards, which added to hygiene issues. Without regular washing, beards trapped dirt and food particles, becoming breeding grounds for bacteria and pests. Soap was a luxury item, and when it was available, it was often harsh and made from animal fat and lye, which could irritate the skin. Lice, fleas, and bed bugs were ubiquitous, infesting not only clothing but also bedding and living spaces. These pests caused constant discomfort and could transmit diseases. Boiling clothes and bedding was one method to combat infestations, but this was not always feasible due to water scarcity and the effort required. Women, while more likely to maintain some level of cleanliness, still faced significant obstacles. They often used homemade remedies, such as baking soda or vinegar, for personal hygiene. Privacy was a rare commodity, making bathing and washing difficult. Dust storms and the general dusty environment of the frontier exacerbated cleanliness problems. Dust settled on everything, including skin and hair, and without regular washing, it was nearly impossible to stay clean. The limited access to clean water made daily washing a luxury few could afford. Public facilities, such as bathhouses, provided some relief but were often located in larger towns and required payment, putting them out of reach for many. Communal towels and infrequent cleaning of these facilities also posed health risks. Number 4, toilet facilities. Toilet facilities in the Wild West were basic and often hazardous to health. The standard setup was an outhouse, a small wooden structure with a hole dug into the ground beneath it. These facilities were breeding grounds for flies, mosquitoes, and other insects, leading to widespread discomfort and health issues. People used whatever materials were available for wiping, including leaves, grass, and even corn cobs, which were harsh and unsanitary. The outhouses lacked proper ventilation, resulting in a strong odor and an accumulation of bacteria. This setup led to the spread of diseases such as dysentery and cholera, particularly during warmer months when flies and other insects were more active. The waste from the outhouses could contaminate nearby water sources, compounding health problems. In more populated areas, some outhouses were designed to accommodate multiple users simultaneously, often with little privacy. These communal facilities increased the risk of disease transmission. The use of chamber pots inside homes provided a temporary solution, but required frequent emptying into the outhouses, adding to the unsanitary conditions. Improvised solutions, such as using ashes or lime to cover waste, were employed to manage odors and reduce the presence of insects. But these methods were not always effective. The lack of sanitation infrastructure meant that even these rudimentary measures were difficult to maintain consistently. Number 5. Water quality. Water quality in the Wild West was alarmingly poor, posing significant health risks. Rivers and wells, the primary sources of water, were often contaminated by human and animal waste, leading to frequent outbreaks of diseases like cholera and dysentery. Water sources served multiple purposes: drinking, bathing, and waste disposal, compounding the contamination problem. Many settlers fell ill from waterborne diseases, with fatalities being common. In mining towns, water pollution was exacerbated by chemical runoff from mining activities, including mercury and cyanide, further degrading the water quality. Settlers had little knowledge of water purification, relying on boiling when fuel was available, but this was not always feasible. The lack of proper sewage systems and the widespread use of outhouses added to the contamination, as waste often leached into nearby water supplies, making clean water a rare and precious resource. Number 6. Medical practices. Medical practices in the Wild West were rudimentary and often hazardous. Settlers relied heavily on home remedies and folk medicine, which included the use of dangerous substances like mercury and sulfur. These treatments frequently caused more harm than good. For instance, mercury was used to treat syphilis, but often led to mercury poisoning, which could be fatal. Professional medical care was scarce, with few trained doctors available. Many settlers resorted to the services of self-proclaimed doctors who lacked formal training. Common practices included bloodletting and the use of purgatives, which weakened patients rather than curing them. Infections from injuries were a leading cause of death due to the lack of antibiotics and sterile techniques. Simple wounds often became fatal due to septicemia. Surgery, when performed, was done without anesthesia until the mid-1800s, leading to excruciating pain and high mortality rates. Amputations were common for serious injuries, and the survival rate was low due to infection and shock. Childbirth was particularly perilous, with high maternal and infant mortality rates. Number 7. Communal living. Communal living in the Wild West was characterized by cramped and unsanitary conditions. People often shared small cabins or tents, with entire families or groups of travelers packed into single rooms. This lack of space meant that privacy was almost non-existent. Individuals frequently slept in the same clothes they wore during the day, leading to widespread infestations of lice and fleas. Beds were often simple straw mattresses or bedrolls on the floor, which provided minimal comfort and harbored pests. The communal nature of these living arrangements meant that illnesses spread quickly. In addition to lice and fleas, bedbugs were a constant problem, making restful sleep difficult. The close quarters and poor ventilation exacerbated these issues, creating an environment ripe for respiratory infections and other communicable diseases. Bathing facilities were rare, and when available, they were typically shared among many people. This further contributed to poor personal hygiene. Cooking and eating were also communal activities, often conducted in the same cramped spaces, leading to additional hygiene challenges. Shared utensils and cookware increase the risk of foodborne illnesses. Number 8. Disease and mortality. Disease and mortality were rampant in the Wild West due to harsh living conditions and limited medical knowledge. Common diseases included cholera, dysentery, and typhoid fever, which spread rapidly in the absence of proper sanitation and clean water. Epidemics were frequent, exacerbated by the communal living arrangements and the use of contaminated water sources for drinking and washing. The lack of effective medical treatments meant that even minor injuries and illnesses could become fatal. Infectious diseases often went untreated or were improperly managed, leading to high mortality rates. The close quarters in settlements and camps facilitated the quick transmission of diseases. Malnutrition and poor hygiene further weakened immune systems, making people more susceptible to illness. Overall, the combination of these factors created a perilous environment where disease and death were common occurrences.